At Griner Bio 1, our focus is on safety. This video illustrates the proper use of the Vacuette Safety Blood Collection Set. The device is designed for your safety and is available in various needle gauges, tubing lengths, and holder options. Safety features of this device include in-vein activation to reduce needle stick exposure by securing the sharp at the venipuncture site, an audible click to assure the user that the safety lock has been activated, complete control of needle retraction from the patient's vein. Now let's demonstrate the use of the Safety Blood Collection Set on a patient in a clinical setting. Remove the device from the package by tearing the notched edge at the Open Here mark. Remove the device from the package. Unlike other winged collection devices, the tubing on the Vacuette Safety Blood Collection Set does not retain its coil, making its use and disposal easy and safe. Remove the protective sheath from the lure adapter and thread it securely into a Vacuette tube holder. A syringe can be attached after removing the lure if that is the preferred collection method. Vacuette Safety Blood Collection Sets are also available pre-assembled with holders. Once assembled, apply the tourniquet and determine the venipuncture site. Place the patient's arm in a downward position and cleanse the site with 70% isopropyl alcohol. Allow the alcohol to dry before performing the puncture. Performing the puncture before the alcohol is allowed to dry can hemolyze the sample and cause discomfort to the patient. If collecting blood cultures, follow your facility's protocol for proper site preparation with an appropriate antiseptic. Immediately prior to needle insertion, remove the protective shield from the needle. With the thumb of your free hand, pull downward from the puncture site to anchor the vein. Inform the patient of the imminent stick and, with bevel side up, insert the needle into the vein at a 30-degree angle or less with a steady advance. Once the vein is accessed, a flash of blood will be visible through the translucent shield. If a winged collection set is used and a coagulation specimen is drawn first, a discard tube, a no additive or coagulation tube, should be drawn prior to collection to ensure proper fill and anticoagulant to blood ratio in the coagulation tube. Put the first tube to be filled into the tube holder and advance it onto the interior needle so that it punctures the stopper and blood enters the tube. Hold the tube in place with the thumb to ensure a complete vacuum draw. Underfilling specimens may affect specimen integrity and alter test results. If possible, the tourniquet can be removed with successful blood flow. After the tube has been filled, remove it and immediately invert it several times so that the blood properly mixes with the additive. If multiple tubes are required, insert the next tube, according to the proper order of draw, and repeat this process until all tubes are filled. When all samples have been obtained, if it hasn't already been done, ensure that the tourniquet is removed and place a gauze pad over the insertion site without applying pressure. Anchor the wing of the device with a thumb or finger. Activate the safety mechanism by pressing in the two clips, located on each side of the clear area on the body of the device, with one hand to release the lock. Pull back until an audible click is heard and the lock is engaged. Anchor the wing, pinch the buttons, and pull back until you hear and feel the safety engage. After the needle set is retracted, apply pressure to the puncture site. The Safety Blood Collection Set is now fully and permanently activated, protecting the user and all waste handlers from accidental exposure. Discard the entire assembly into a sharps container. Once bleeding stops, apply a bandage to the site. To summarize the use of the Griner Bio 1's Safety Blood Collection Set, thread a tube holder onto the lure. Apply a tourniquet and select the intended puncture site. Cleanse the site with the appropriate antiseptic. Remove the protective shield. Anchor the vein by pulling from below the intended puncture site with the thumb of your free hand. Insert the needle at a 30-degree angle or less with a steady advance. Insert the first tube into the tube holder and allow it to fill. Release the tourniquet once blood flow is established. Remove and invert the tube. Repeat with other tubes as needed. Place a gauze pad over the insertion site without applying pressure. Hold gauze in place while anchoring the wing. Activate the safety feature by pinching the sides of the clear piece just below the blue body. Pull back to retract the needle into the body until you hear the click and feel it lock. Anchor, pinch, and pull. Then, apply pressure to the puncture site. Discard the device into a sharps container. Once bleeding stops, apply a bandage to the site. Thank you for choosing the Vacuette Safety Blood Collection Set. The complete line of Vacuette Safety engineered devices can be seen at gbo.com or by contacting your local account.